Hello, and I've got with me today Associate Professor Sharon Latimer, and I'll let Sharon introduce you to her research and our discussion today. Thank you.
Great, thank you. Hi, my name is Sharon Latimer. I'm a academic here in the school and also a principal research fellow in the CRE for Wiser Wound Care, which is within the School of Nursing and Midwifery. The area of my focus is pressure injury prevention, and the other areas that we focus on in terms of research include surgical wounds.
Mhm. And one of the things that Sharon had talked to me about was how sometimes the clinicians come to her with a problem. And so, do you want to just go through one of these times?
Yeah. So back in 2019, I was working at Gold Coast University Hospital with Professor Bridget Gillespie, and a couple of the clinicians within the palliative care unit had actually approached us and spoke to Bridget about the fact that they'd seen these wounds in dying patients that looked like pressure injuries, but their experience had told them that it probably wasn't a pressure injury, but they couldn't find anything in the literature or within the clinical practice guidelines to provide them with some guidance regarding patient care.
Yeah. So that was an interesting problem that they came up with. So, what were one of the first things that you talked with the clinicians about?
Mm. So the very first thing that we talked about was what's in the evidence.
Yep.
So we did a really quick Google search to see if there was anything in the literature about Kennedy Terminal Ulcers, and we found a couple of papers. There really wasn't a lot. And so, one of the things that we decided to do as a team, because we saw a huge gap, not only in clinical practice, but in terms of evidence, was that we decided to undertake a scoping review.
That's the first step then.
Yeah,
Really
yeah,
looking at that evidence and
yeah,
understanding what's been published before.
yeah, yeah. So, we actually mapped the evidence,
Hmm.
and there was not a lot of evidence. So, you can just imagine there was a whole heap of clinical practice gaps.
Yep.
So, after the scoping review, we undertook another integrative review. So, that was more of a focused review.
Yep.
And basically, the team from there decided that the first step that we needed to do for clinical practice was to develop a wound assessment tool that would help clinicians determine whether or not the wound that they had seen in a dying patient was a pressure injury or an end of life wound. And subsequently, this was the first tool to ever
Hmm.
be developed. And it was only because the clinicians on the floor asked the question, what are these wounds? We can't find them in the literature,
Yeah.
and we've got no clinical assessment tools to help us
Yeah.
in a clinical practice.
So I hope sort of as you listen to that, so the first thing that Sharon did was the broader scoping review. So this is where you might include other hospitals' policies, grey literature, theses, um, and that I sort of gave the team an idea of what's
Mm.
out there. And then the integrative review. What sort of evidence came with that one?
So, what we found in that particular review was that there were really only four primary papers, because, as you've
Yep.
indicated, Liz, the scoping review did include grey literature, and but there was only four papers that were conducted observational research, and they were all conducted in the US, so
Mm,
quite
yes.
biased,
Yeah.
and conducted by nurses, which is a great thing. But it really did give us the impetus that we needed to move forward in this area. And we've just finished conducting a pilot test of the new wound assessment tool
Yes.
that we've developed.
So we might look at Sharon's actual research now. And this is the research team. And then if we move on to the next slide. So I'll let Sharon talk
Yeah.
about this then.
So you can see on the slide here, so I've got two pressure injuries and two end of life wounds. And just looking at the wounds, they do look quite similar. Now, the difference between a pressure injury and an end of life wound is that a person that is not dying cannot develop an end of life wound. but a person who is dying can develop a pressure injury and an end-of-life wound at the same time. Now, the whole etiology of an end-of-life wound is that the skin, as part of the dying process, is starting to die. So, for the tool that we developed, one of the key sections in that tool is really figuring out whether or not the person is dying. Do they receive pressure injury prevention? Has there been any direct pressure? Because an end of life wound will develop in the absence of pressure. And so it really is around undertaking a comprehensive assessment that involves the team, not just looking at the wound and deciding whether or not it's a pressure injury or end of life wound, because the management is really quite different. So for a pressure injury, the management is prevention and then healing, whereas for an end of life wound, the management is around that comfort care for patients.
And so this is the publication that Sharon's team, which did include 2 registered nurses who are working in the area, and what they have then published. And the last slide looks at the actual assessment tool. Now, this is when you're thinking of advanced practice nurses whom identify a problem, work through it, and then actually are able to change and improve practice, which is exactly what the team of nurses that Sharon worked with were able to do.
Yeah. Yep.
So thank you for listening, and hopefully you've found this both intriguing of what end of life pressure areas look like, but also understanding your role as an advanced practice nurse in influencing and improving practice for our patients. Thank you.
Good luck.